Today I'm going to talk about facial rejuvenation in men without leaving scars or visible scars. This patient had a forehead eyebrow ptosis with limitation of the vision field, flaccidity on the upper eyelid, we can see here, upper eyelid fat pad and lower eyelid fat pad. From the malar area to the scalp, I do not remove skin, I do not leave visible scar. I reposition the forehead with 3 minimal incisions that I call pivoting brow lift. You can look for in my website, rejuvenation of the eyebrow and forehead. Patients around the world coming to my clinic in order to reposition the eyebrow and the head. And also, since 30 years, I perform a blepharoplasty without skin resection. I do not leave a scar here and here. And then this patient is going to perform pivoting brow lift, a blepharoplasty without skin resection. But also this patient have a lack definition between the face and neck, lack definition of the jawline, fatty and ptosis of the neck, and here I perform a treatment that I call Ultherapia, which I produce externally a liposis and skin tightening and skin rejuvenation. Here we can see all the characteristics of the face. No jawline, fatty neck, ptosis, and here we can see a deep nasolabial sulcus with a big elevation here, this big bridge. This is the blepharoplasty that I perform. I remove the upper eyelid fat pad through this stab incision, no sutures. Here through transconjunctival incision, and you are going to see this procedure I perform under local anesthesia with sedation ambulatory. Here is the treatment that I perform. This treatment I call Ultherapia. Is a HIFU that I developed with engineers of Bison firm, and with this Ultherapia I tighten in the skin, I produce liporeduction of the neck, improve the jawline. Here we can see the pre of the patient with the ptosis, with the fat, with the lower eyelid fat pad, and in the other side we can see no scar, skin tightening. Here you can see the lower lid cheek junction is in this area, and here the lower lid cheek junction is up here. The distance between the tarsus and the malar area is very short, here is very long. I remove the lower eyelid fat pad and improve the cheek. Here we can see the lower eyelid fat pad, the distance between the eyelids to the malar area very long. Here you can see how improved. Also here we can see a lot of flaccidity, and here we can see how was tightening the skin, and also you can see no scar at all. I can use more laser energy to contract this skin, but the patient needed a quick recovery. Here you can see the changes of the face. But here is the most interesting. You can see the improve of the face, the improve, this patient look younger, rested. Here we can see a square face with big elevation, big depression. Here is almost even. With this technology I lower this elevation and I put more even the sulcus with the cheek. With minimal hyaluronic acid injection, I even the face to the labia. But you can see here is very interesting, a square face, an oval face, and here an oval face. This patient look completely different to this one. If you want to go to the face and neck, you have the jawline. Now we can see here, we don't see the jawline. Here we can see the face hanging to the neck, all this adiposity tissue under the jawline in the neck, and here we can see the difference. In the near view, we can see how the Ultherapia lower this elevation and make even the labia to the cheek. How in 3 hours, with no invasive procedures, I improve the neck, the face, and the jawline. This is a completely different patient. This is younger, is happy, improve the view field, square, oval, elevated, even.